So you're driving a commercial vehicle and you have diabetes. It can get pretty confusing, right? Especially with all the rules and how they seem to change. If you've ever felt kind of lost in the paperwork or just weren't sure where you stood, well, this explainer is going to make it all make sense.
Yeah, if you're a commercial driver managing diabetes, I'm betting you felt the frustration of just trying to keep up with all the regulations. The good news is, the system has changed. I mean, dramatically. And honestly, for the better. We're about to walk you through exactly how it all works now. Okay, so to really get why these new rules are such a game changer, we first need to take a quick look back at the old system. And trust me, it was a frustrating bureaucratic mess. Before 2018, if you used insulin, that was it. You were automatically disqualified from driving. The only way forward was this long, tangled federal exemption process. It was a total bureaucratic roadblock that could put you on the sidelines for months, costing you income, causing a ton of stress, all while you were just waiting on paperwork. It was a nightmare. But then, thank goodness, 2018 rolled around, and the Federal Motor Carrier Safety Administration, that's the agency that sets all the safety rules for commercial driving, they completely overhauled the entire process. So the single biggest change was just getting rid of that slow, centralized exemption program altogether. Now the decision to certify a driver is in the hands of a certified medical examiner who works directly with your own doctor. This puts the focus back where it belongs, on actual medical expertise, not just mountains of paperwork. And look, this wasn't just about shuffling paperwork around. It was a whole new philosophy. The modern system is built around one single core idea: prioritizing your real-world, on-the-road safety over some abstract clinical numbers on a lab report. This table here, it lays out the two different mindsets perfectly. See, your personal doctor is focused on your long-term health. They're looking at things like your A1C, which is your average blood sugar over a few months, to prevent complications years down the road. But the DOT, they have a very different, much more immediate job: ensuring public safety today. Their absolute top priority is preventing a sudden medical emergency behind the wheel. That's why a severe low blood sugar event, or hypoglycemia, is their number one concern. And this focus on hypoglycemia, well, it naturally leads to the most common question that drivers ask. Hey, if my A1C is so important to my doctor, why isn't it a simple pass/fail number for the DOT? And the answer is really simple, but it's so important. A high A1C might signal a long-term problem, sure, but it doesn't predict if a driver is going to suddenly pass out today. A severe low blood sugar event, on the other hand, that is an immediate, clear and present danger. That's the threat these rules are designed to prevent, period. Okay, so that's the why behind all the rules. Now, let's get into the how, the practical, step-by-step process for actually getting certified if you use insulin. The whole pathway is so much more straightforward now. First up, you see your own treating clinician, the doctor or specialist who actually manages your diabetes. They'll fill out a specific form, the MCSA 5870. Then, you take that form to a certified medical examiner who reviews it, looks at your overall health, and makes the final call on your certification. Simple as that. And here's a really critical deadline you have to remember: that 45-day number. Once your doctor signs that form, a clock starts ticking. You absolutely must see the medical examiner within that 45-day window, or you got to start the whole process all over again. And here's another hard and fast rule. If you're treated with insulin, the absolute longest certification period you can get is 12 months, no exceptions. This just makes sure that your condition is stable and being safely managed with at least one big review every year. All right, so we've covered how to get certified. Now let's flip that around and talk about the red flags. With this laser focus on immediate safety, what are the specific conditions that will prevent you from getting that certificate? The number one disqualifier, the big one, is a history of severe hypoglycemia. And the definition here is very precise. We're not talking about just feeling a bit off or shaky. A severe episode is one where you required help from another person, you lost consciousness, or you had a seizure. Any event like that is a major red flag for the DOT. Beyond that, there are a few other conditions that can be disqualifying because they directly impact your ability to drive safely. Things like not being able to feel the warning signs of low blood sugar, having vision problems that don't meet the standards, or nerve damage, neuropathy, that makes it hard to feel and control the pedals. As you can see, it all comes back to one thing: your functional ability to operate that vehicle safely at all times. This quote really just sums the whole thing up perfectly. Your doctor is playing the long game, focusing on your overall health for years to come. The medical examiner, on the other hand, is focused on immediate safety for you and for everyone else out on the road. They're two different goals, but both are absolutely vital. So, as we wrap this up, here's the final thought I want to leave you with. Now that you understand the DOT's laser focus on preventing sudden, dangerous events, is your daily diabetes management aligned with that goal? It's a question that could really make all the difference for your career and, more importantly, for your safety out there on the road.